And actually, I was qualified in March, and I was transplanted in November that year. And but I'm still paying a large copay for my Prograf and all that. I don't know. That's why I'm here asking now.
That's interesting. Yeah, typically.
I don't know why I'm paying for. I've heard this before that people weren't paying for
Right.
Prograf, and I'm paying for Prograf.
And every insurance is different. So again, if you're running into specific problems like that, just give me a call.
I also make a statement before this one I do what I used to do. And they would send me my prednisone, which I'm on for life.
Yeah.
They would charge me something like $12 and 24-hour shipping. For 90-day supply, I went to Dearborn and I paid like less than $2. Medicare was paying something like 3 months, $78 to $100. I mean, if I were you, I would tell your patients you can afford $2 every 90 days instead of
Prednisone's actually on the $4 list at Schnucks and Walmart. You don't even have to use your insurance to get your medicines or the prednisone.
But yet, if you go through the specialty pharmacy because Medicare pays for it,
yeah.
So how do we get this free Prograf? That's all I want.
I actually brought a big bag with me. I'm just gonna throw it out.
Pass it around.
I'm not gonna watch.
We're all using that.
Yeah.
Tell me how I can get
But those immunosuppressants are complicated. The billing issues are really complicated. We deal with insurances all the time. I have patients calling me day in and day out saying I can't get my medicines. I'm running into billing issues. That's something that we can talk one-on-one about, offline, and we can take a look at it and see, that
and I
we
need
can
my
get this.
meds. I'm down to like a 10-day supply.
Okay, in that instance, if you're running into issues and you're getting low on your medicines, you absolutely need to call the transplant office. You need to call me, and we can see what we can do to make sure you don't run out of your medicines while we sort through
Because
this.
Medicare used to supply you with a 90-day supply. Now it's monthly.
Yeah, so there's a lot of changes in the healthcare system and Medicare and insurances, and it's very complicated. And it doesn't go away once you get transplanted. It just is compounded. So that's what we're here for. Exactly. Yeah.
Well, and so these are some of the, that's why I start with the healthcare economics, because you have all these folks in Washington who I was going to tell a joke, but I'm not going to tell a joke. They are crunching these numbers, and what they're finding is when we gave you 90 days supply, there's X percentage of the time that the doctor changed that prescription, and 60 days of it gets wasted. So, yes, I have parents who are ancient. God bless them, 91 and 89, and they're in phenomenal health. That's bad news for my wife because she stuck with me for a long time because I have great genes. But yeah, it affects. My dad called me, same thing. He's like, they are not going to give your mom her thyroid medicine in 90 days and blah, 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 blah.
Yeah, they stopped that because for the 30 days, and then once you use it, they figure you're going to be on it, then they'll start giving you 90 days.
So yeah, absolutely. Before we leave, we got to talk to you so that we make sure A, you do not run out, and then B, we sort through the mess in the background. These women are phenomenal at this, and one of the things that impresses me so much is that Nina and her colleagues up there in that AG office, they are talking about these things that would just bore the snot out of you and me. And they're talking about where can we get it for $4 or $2, and they're sending emails all the time with, we found a new resource, we found a cheaper way to do this. So they won't know everything, but they'll know a lot of things, and they will know some of these pharmacies that don't understand how to do the billing, they will know that. And if we can move around them instead of causing problems, if it's the closest pharmacy for you, then we'll work with them. We have pharmacists. Yeah, we have pharmacists that, again, the good thing about being Barnes is we have nurses, we have doctors, we have pharmacists, and we always, as a part of our community effort, is we will educate people outside of our building. So I have offered before to have my nurses go to a skilled nursing center in teach their nurses how to do something. Send my pharmacist to talk to them about how to do this and how to do this
Can we
bill.
get our medicine through Barnes Pharmacy?
No. That's a good question. Our outpatient pharmacy, you can theoretically, but our transplant office and Dr. Ewald and Cindy, we prefer you to go through a specialty pharmacy. Barnes Hospital is not a specialty pharmacy, believe it or not. And if you have Medicare, they do not have the ability to bill Medicare Part B for your immunosuppressants. So unfortunately, it doesn't really work out to your best interest to go through our hospital pharmacy. You're better off at a specialty transplant pharmacy. Are there any other questions? Yeah.
When are you going to get help?
Megan's ready.
So that is one of the things that wakes me up at 3 o'clock in the morning.
I'm just asking because, like you said, the LVADs are going to increase, and you're going to have more post-transplant. I mean, you do an excellent job. I mean, when I volunteered up there, I mean, all of you ladies are excellent what you do, but I know some of you like to pull your hair out sometimes because sometimes you feel a little bit overloaded.
Yeah.
It's not a loaded question. I'm
No, it's
just
not.
wondering.
Yeah, so I did get all 10 of my positions back this year. I filled 2 that will be for other positions that will be filled by the end of this month, and I just got 3 more approved. One of them will be the transplant position. And really, so I have a question for you all, because this is a topic that I drive everybody at our place crazy about. So my question is, probably all but you know Megan, Jennifer, or Nina. And you met her at the beginning and she ran around and followed you through. So the question that I've grappled with for about the last 6 years is, do I pull all the social workers off the cardiac floors and do what we would call front load the system? So put all those people in with Nina. And so when a person would come in for a referral, if there were 3 of us, it'd be 1, 2, 3. You're the first one that came in, Nina would get, I would get the second one, this person would get the third, and I would stay with that patient throughout the duration. So that's one way of doing things, but my question to you is, when you were on the inpatient units, did you ever work with a social worker?
Yes.
Yes.
I don't know. I was knocked out most of the time.
Yes.
But the answer is yes.
Yeah.
We all
So
did.
that, when I talk about front loading, that's the dilemma. I have to take those people off the floor. I don't have enough resource to have both. So I'm just not, after 6 years, I crunch the numbers and I look at it.
One of the things that I do is not upfront, but it's in post-transplant.
Yes,
It's
the
the
post-transplant.
readmittance
Yes.
that are getting
Yes.
this.
Yeah.
Yes.
And
I think that goes to.
I think we've talked about it, so I know that you have the answer, but that's why I'm bringing it up, because I know it's on everybody's mind.
Sure, absolutely, and that's a great question. Many people are used to having, I think in the past, many people, Jennifer or Megan or so, who, no matter if you were inpatient or outpatient or where you were in the hospital, that social worker was going to follow and address all of your needs. Because our caseload is expanding and our program is growing exponentially, what you'll find is if you are readmitted to the hospital as a post-transplant patient and you're on 8100 or 2100 or 7200, any of the cardiac floors, you're actually going to be followed by a different social worker because there's a different social worker that's assigned to every floor. So unfortunately, I would love to be able to address and go and visit and make sure and check in with every single post-transplant or post-VAD patient, but at any given time, what we're typically seeing is currently, as of today, we had 40 LVAD or post-heart transplant patients admitted various places throughout the hospital. And that's in addition to all of our outpatients. So logistically, I can't go there, but that doesn't mean that people can't call and say, I have a need, can you help me?
So when you're talking about having all of the medical records go, are the floor social workers able to look at the medical records that are there at Barnes? And will they be able to access, like, I go out to Barnes West for my follow-ups and stuff like that. Are you all interconnected? So, as well as with, like, the dermatologist and, you know, my regular primary care, I know I signed a paper where you got all to be able to interconnect, so.
Yeah, if you're at a BJC facility, pretty much, I mean, they have a unified desk, you know, all your records.
We have this, I mentioned it earlier, a Shell program, and it's called Clinical Desktop. And so all these electronic medical records feed into that one. It does not feed everything. So I'll give you an example. If say, for instance, you're on a ventilator, there are going to be the notes from the respiratory therapist about that. They're going to be the initial settings. But that machine pumps out data on 26 lines every minute it's running. That stuff doesn't all dump. So we get the reports, we get the notes, we get the test results. So yes, we can see all that. Any of the
So if you're
hospital
being admitted into the hospital, why doesn't it pop up then?
Why
So
doesn't
that
what pop up?
Why doesn't it come to you when we're readmitted?
I like him. He thinks like
Should we
me.
hire you?
That's what I say.
Yeah, maybe.
That's what I say to our IT people.
Yeah.
I say to them, when I go to that chart, when Bob's back in the hospital, it should just pop up at me. Does it on my Apple iPhone, does it on my iPad. If it can do it there, it should do it
The
there.
answer is it doesn't right
It
now.
doesn't yet. And I get in trouble for saying that.
To me, I think it just makes sense.
Makes sense.
That's why it's not done.
That's why it's not done.
Well, so I will tell you, there is a program out there that does it. All the other, well, SSM, Mercy, and St. Louis University all use a program called Epic. And because I manage my parents' healthcare, and they have a Mercy doctor, and a lot of those doctors are residents that I've worked with through my career at Barnes. So I've asked them, show me this, show me this. So there is a program that does pop up. Excuse me. And I've been invited to a big meeting in the middle of June to look at that program and several others, and for us to go to that. Now, I'm a big advocate of that, because if we sign on to Epic, even though it'll be terrible to change and train everybody, the nice thing about that Epic program is if you show up at DePaul or St. Mary's or Mercy or one of the Mercy clinics, all those notes pop up. If you go to SLU, those notes pop up. So my 2 cents worth to the hospital is we got to go to Epic. Everybody else is on it. And I will tell you, when I talk with the IT people, and you know, everybody gets a say in this stuff. So you get all these people at the table. You get the information technology people, you get the treatment providers, you get the compliance people. I don't like compliance people. If there are any of you are compliance people, I'm sorry. I don't like you. You are the bane of my existence. Because what the compliance people will say is, Jim, if you have all that data out there, somebody will misuse it. There's the potential for somebody to misuse it. And I'm actually a psychologist by training, and what I say back to that is, I will guarantee you somebody will misuse it. That is human nature. There are bad people in this world. They will do bad things. And when they misuse that information, I will fire them. Because that's my job. And I am proud to say, in my 23 years at Barnes, managing social workers, I have never fired a social worker. Because when I hire them, what I just said to you is what I say to them. If you misuse this information, I will fire you. And I will chase you down. I will report you to the licensure board. I will do everything in my power to prevent you from ever practicing again. My wife says, you know, you are the scariest man. I gotta think I'm mean.
How does My BJC work with you? I mean, are you connected to that? Like if, for instance, I'm being admitted, someone in the family can connect to you on My BJC. Is that something that's
Every one of you
available
ought to
you?
be on My BJC, I'm on My BJC. My parents are on My Mercy.
Yeah.
And I manage all their health care, their appointments, I get their test results, I get emails when their next appointment's coming up to remind me.
Right.
You
So
should
that's where
be
they're
on My
going.
BJC.
That's where they're going. So
Right.
the question is,
wonderful.
if something happens to, if it's not popping up automatically,
Right.
is there a possibility to notify you through My BJC? Are you on that as a
No,
link?
not currently. No, what your family would have to call.
Yeah.
Call the transplant office, call Cindy, you know.
Yes.
Cindy will let me know.
And then it just trickles down.
Call me
You
directly.
have questions over there?
Absolutely,
You've
yeah.
been ignored for a while.
Go ahead.
Okay, so when I originally got the Affordable Care Insurance, I called your office, talked to Tina, she said, well, there's 2 places you should go. You know, I had a great Anthem policy, but we sold our business, so I had to switch over to Affordable Care. It's been a nightmare for my life. So she said, go to United Healthcare or Covenant. Okay, so the insurance guy said, and I'm paying for my own insurance, it's not like it was free. So she said, well, go to United Healthcare because it's more universal. So my first question is, when I was at hospital this weekend, which is at a BJC facility with my daughter, separate related, they only had Coventry posted out there. They
We
said
only-
Coventry.
We've only taken.
So-
Is this the most bizarre thing in the world?
Yeah.
We're like one of the top 10 hospital chains in the country, and we're on one plan.
Right, well, see, I have United Healthcare. I signed up for them because that's what the insurance guy said, well, you know, they're kind of nationwide. They have been a total nightmare.
Yeah.
I have a program and I have a cell set card. They don't accept those. You know, I have a $10 copay thing. We don't accept that. You can't do mail order. You can't be online. And you know, they made my life just totally forbidden. You know, you do 90 days because if they give you 90 days,
Yep.
you know, and you die in
Yep.
1 month, they give you 2 months worth of medicine. They
Yep,
don't
I
pay
know
for.
exactly what you're
So
talking
should I
about.
switch over to Coventry, you think? Would I be better off with, I mean, I've had 4 months of a nightmare just getting my medicine.
I remember.
Oh, you
You're-
remember me? Because I've been a
Yeah.
nightmare for you.
No, I remember it's been such a nightmare. You're absolutely right. The problem is what we run into a lot of times post-transplant is you have an insurance provider who mandates that you use a mail order pharmacy, but then they're charging you a $300 copay for your medicines, but they will not take the copay cards that we can get you or the
They
grants
won't
that
even
I
let me
can
do
get.
the mail order.
Yeah,
They
it's,
send me the envelope, say, here's your mail order, and here's your medicine.
yeah,
I said, okay, I want to sign up for it. They say, no,
Yeah.
you can't do it.
Yeah.
So it has been a total craziness.
Yeah,
for
I
us.
know.
So I finally got it
Actually,
out.
had to deal with.
You have United Healthcare,
Yes, I do.
and you're having a problem getting the program through, is that right?
Well, no, I get the program.
Okay.
I have to pay a lot of money for it, and they
Yeah.
won't accept
Do you get the
program
generic
policy.
version of it?
Cindy said they don't like the generic.
Well, no, not,
There is one.
there's, not the Dr. Reddy, but there's a different one.
yeah.
Yeah,
Tech
there's.
Yeah, I'll tell you
I
about
had
it
to
after
change, I
this.
had to change
I'll tell
pharmacies
you.
because
Yeah.
they,
Well, whatever
Wouldn't cover my
I think
program.
Cindy and them worked it out, or somebody over there, because I was a total nightmare to the transplant office, but all I want to do is get my medicine.
No, absolutely, and that, I mean, that was something, you know, if it's continuing to be an issue, I mean, the number one thing is we never want somebody to go without their medicines, so,
So should I switch over to Coventry? Would I be a lot better off?
that's something, I mean, we can talk one-on-one, and we can get specifics,
But I don't want to
because
start all over because it's been 4 months to get
Exactly.
this medicine straight.
you don't want to switch. The main thing I would say to people, if you're post-transplant and you're looking at changing insurance plans, you need to call our office first, because we need to verify that A, you can get your follow-up care at Barnes for your transplant, and then B, that you're going to have adequate access to your medicines. So don't just go switching an insurance plan without contacting us first, so we can kind of check it out and see, make sure it's a good choice for
I
you.
just noticed they had a big sign out at Missouri Baptist, you know, like I said, it was on unrelated
Yeah.
matter. Coventry, that's the place you need to go, and I'm like, oh, man.
Yeah, through the Affordable Care Act, there's 2 plans available, a Blue Cross Blue Shield and a Coventry, and currently BJC only takes the Coventry plans. So just
But
FYI.
that's only with.
The Affordable Care Act.
Affordable Care.
Doesn't apply to anybody who has any other existing insurance. Any other questions? Sure. Here.
Completely away from insurance. On the
Thank you.
No, I'm just kidding.
on the LVAD support group.
Yes.
I was wondering if maybe we could maybe get a group together of the transplants and the caregivers, and maybe go to an LVAD support group and
Absolutely.
you know, just let them know that we are there to support them.
Absolutely.
And let them know about us, because they don't really know about us.
Yeah.
We didn't know anything about this until after we
Right.
got the transplant.
I think, Vince, you came a little,
I came
Few.
a couple times, yeah.
couple months ago or
And
so,
I'll
but
probably come again.
yeah, absolutely. Every now and then, you know, we go ahead and have Vince come on by
Okay,
and give out information, and then we've got brochures, but that's a great idea.
Yeah.
So we can talk, you know, about arranging something that like this summer or this fall, you know, I think it's a great idea.
I work with a lot of organizations externally. You guys are the most phenomenal organization that I work with. You really are. I've said to Vince, you know, whatever we can do to continue this partnership, the support that you provide to each other is unequal anywhere else.
But we can be a pain in the ass too.
Can't everybody? I think I'm a wonderful guy most of the time. No, you guys are just really phenomenal. I mean, no other organization that I work with, no other disease program provides the support and care for each other that you do. And that is just, I gotta tell you, as a social worker, that's what gets me up and gets me doing this every day. I love providing care, and I love it that you guys are this involved. And I have to tell you, at our hospital, a lot of times, we see patients who have no family, no friends, no support. So to see what you provide to each